Good evening, doctors. I'm Dr. Prachi from Shield Healthcare. We will start in another 2-3 minutes. So thank you for joining.
No, don't blame me. Then, don't blame me.
Sweta ma'am, shall we begin?
How many participants?
Chitra, can you just type it out?
Yes, ma'am. I will update you in another 1 minute, ma'am. I'm working on it. 1 minute.
Okay, great.
One out one, ma'am.
Hello? Yeah.
Hi, ma'am. Hi, Dr. Sweta, ma'am. This is Dr. Someshwar here.
Shweta ma'am, shall we start? Shall we begin?
That's what you must have given, no? He said he- Yeah, we can start.
Okay, ma'am. Thank you very much. So good evening, doctors. I'm Dr. Prachi from Shield Healthcare. So many thanks for joining this webinar. We have eminent speaker today, Dr. Sweta Agarwal, and actually ma'am need no introduction. Ma'am is MBBS MS Obs and Gynecology FAMS and FRANZ COG from Australia. Masters in Reproductive Endocrinology and Infertility from Australia. And ma'am is currently Director, Fertility and Gynecology, Southern Gem Hospitals, Hyderabad. Ma'am was formerly Assistant Director and Consultant Fertility Specialist in Pivot Medical Center, Perth, Australia. Ma'am was author of chapters in ISAR, IFS, POXI, and ACE consensus best practice recommendations for infertility management and Ballary's best practice and research in clinical ops and gynecology. Course director of IMA AMS Fertility Fellowship Program at Southern Gem Hospital. Also, ma'am was invited as faculty at numerous national and international fertility conferences and faculty at hands-on hysteroscopy workshops across various states in India. So with this, may I request Dr. Sweta Agarwal ma'am on her talk on potential role of vaginal microbiomes in infertility. So thank you very much, ma'am, and over to you.
Thank you, Prachi, for this lovely words. And today we've got a very interesting topic about the potential role of the microbiome in infertility. And as we know, microbiome is gaining a lot of importance in all areas, not only in fertility but in all other areas as well, in obesity and a number of areas in heart disease, obesity. There's a big role microbiome. We are getting to know about it. So today we will discuss mostly what could be the role of vaginal microbiome in infertility. So as we know, there is a collection of microorganisms which are on the body or inside the body, and this actually constitutes the microbiota. And the complete genetic profile of this microbiota is the microbiome. And these bacterial cells, they account for 1 to 3% of the total body weight and are at least an equal number to the human cells. This microbiota, they interact actively, both beneficial and detrimental, within the internal milieu of their host. The vaginal microbiome is unique to each woman, and in comparison to the GI microbiome, the microbial diversity within the reproductive tract is relatively low. And Lactobacillus species, they are the ones which are more predominant in the vaginal microbiome, and they play a very important role in all aspects of the reproductive health. So as we know, the 9% of the total human microbiome is in the urogenital site, whereas the GI tract, it is about 29%. So the microbiome, as I said, is gaining so much of importance. It is linked with obesity. When they're planning obesity surgeries, they're looking at the microbiome of the gut and removing portions of the gut which are not good microbiota. And even oral microbiome is linked with some heart diseases. GI microbiome is also associated with PCOS and all. So microbiome is becoming quite important in our fertility practice as well. So the normal flora of the reproductive tract is mainly the Lactobacillus species, which provides a healthy environment for the embryo to grow. So 90 to 95% of the total microbacterial count in the reproductive tract is by the 4 species of Lactobacillus, which is Lactobacillus crispatus, Lactobacillus iners, Lactobacillus jensenii, and Lactobacillus gasseri. These are the 4 particularly important species which are having a role in the vaginal microbiome. And during the reproductive years, it is the hormones, the estrogen and the progesterone hormone particularly, which play a very important role in balancing the vaginal microbiome. So under the influence of estrogen, the vaginal epithelium is going to grow, and there is deposition of glycogen is what is going to happen. And this supports the cytolysis of the epithelial cells. The progesterone is going to support the cytolysis of the cells where there is release of glycogen, and then this lactobacilli, which is present in the vagina, is going to metabolize the glycogen to the lactic acid, which is maintaining the normal vaginal pH of 4. It's very important, the lactic acid, which is from the glycogen conversion under the influence of the lactobacilli, which is going to maintain the pH. And any kind of imbalance because of these hormonal changes which happen, the variation in the level of glycogen or the alteration in the lactobacilli species is going to alter the vaginal pH and going to affect the fertility. And this lactic acid facilitates the release of innate immune system. So the innate immune responses are initiated, which also inhibit the growth of other bacteria other than the lactobacilli. The lactobacilli also act as a mechanical barrier. It binds to the surface of the vaginal epithelial cells and prevents the binding of other bacteria which might influence this epithelial cells. So not only chemically in the maintaining the pH, but also physically it's going to be acting as a mechanical barrier. So because of initiation of this innate immune responses, it provides a defense against pathogen colonization such as Trichomonas, Candida, Gardnerella vaginalis. By making this lactic acid and acidic environment is not going to let these other bacteria grow. So these lactobacilli, they reach the vagina because they survive the low gastric pH and the bile salts. They pass through the intestine and then ascended without any functional intervention. They ascend into the vagina because the gut and the vagina are so close. Now, what is bacterial vaginosis? So vaginal dysbiosis, it can result in bacterial vaginosis, which is one of the most common problems in the reproductive age group of women. There is a complete disruption of the ecosystem of the vagina, and the anaerobic bacteria, they gain predominance over the desirable strains. So there is a vaginal imbalance. The lactobacilli strains are suppressed and other anaerobic bacteria is going to take over. And as a result of which, the other infections predominate and there is a risk factor of sexually transmitted infection. These infections can ascend up into the upper genital tract, causing pelvic inflammatory disease, tubal block, and other issues will be there. And also the vaginal balance is not only essential for fertility, but also patients with bacterial vaginosis are known to have adverse pregnancy outcomes such as increased risk of preterm deliveries, miscarriages, and all are more common in this group of patients. So what is the pathophysiology of the vaginal imbalance? How does the imbalance happen? So increased concentration of interleukin-1 in the vaginal environment. This triggers the generation of reactive oxygen species, which affects the integrity of the membrane, the flexibility of the membrane. This impairs both the sperm motility and the sperm oocyte fusion, and interruption or disruption of the fertilization and implantation will happen. So now let us look at various ART procedures, what we do, the assisted reproductive technology procedures, and how does these procedure have an impact on the vaginal microbiota. So as we know, the vaginal microbiota is controlled by the hormonal balance, the estrogen and the progesterone, which is there in the normal menstrual cycle. The variations of the estrogen and progesterone levels during the menstrual cycle is going to maintain the balance of the vaginal flora. But during the IVF cycle, we give the FSH and LH hormones for the ovarian stimulation, and there is a very high level of estrogen. The balance, the normal menstrual cycle balance of the hormones is disrupted. And then these hormonal changes which takes place during the IVF cycle, they are going to have an impact on the vaginal flora. So so they looked at a few studies where they found that in the women where there was no alteration in the microbial growth compared to the women who had the alteration in the microbial growth, there was a significantly higher pregnancy rate. So those who had no microbial growth, they had a higher clinical pregnancy rate of 57% as opposed to 29% in those the cultures were positive for altered flora. So definitely there is a marked difference in the success of the pregnancy rate with the alteration of the vaginal flora. So the groups who had positive cervical cultures, they have lower clinical pregnancy rate, they have lower ongoing pregnancy rate, and implantation rate were also lower. So the circulating hormones, they have great impact on the vaginal microbiome and also the susceptibility of the women to infection. So there might be increased risk of vaginal infections also in these women. This was a study from 2012, which they looked at the 16S rRNA deep sequencing on IVF patients. They found there was a shift in the vaginal microbiome in some, but not all the patients. So about in all the cycles, treatment cycles, about 33% women had novel bacterial strains. So it's not all the women. So we have to understand that whenever there is a altered hormonal changes which happen during an IVF cycle, not all women will have the shift in the microbiomes. Okay, 33% will have a shift, and we have to identify these women. So, and again, when you're doing your down regulation with the GnRH analogs, the exogenous hormone, they are going to have an impact on the vaginal microenvironment and the composition of the vaginal microbiome. So patients who had 4 months of GnRH analog treatment. So this is a paper from 2014 where they looked at women with endometriosis, where they were given depot preparation of GnRH agonist. They found that the vaginal pH was significantly increased in this group of women to above 4.5. And there was a shift in this group of endometriotic patients. There was the intermediate vaginal flora, and there was a decrease in the normal vaginal microflora. And this is a paper from 2016, which looked at the vaginal microbiome on the day of the embryo transfer. They found that the microbiome composition on the day of the ET has a significant impact on the pregnancy outcome. Women who had ongoing pregnancy, they had Lactobacillus species which were predominant. So while doing ET, it's important to reduce the risk of microbial transfer into the cervix. You have to clean the external os with the culture media, avoid touching the tip of the catheter to the vaginal wall or to the external cervix, because you may be likely to be introducing external organisms into the uterine cavity. Looking at the tubal factor infertility and the microbiome. So whenever you have abnormal vaginal microbiome, there's a significant impact on the tubal factor infertility, which is from 2 papers, one from 2013 and one from 2018. So the chlamydia was more prevalent in bacterial positive patients. And because whenever there's an abnormal vaginal flora, the sexually transmitted infections are going to ascend up into the genital tract, particularly chlamydia and gonorrhea infections. They're going to become predominant, leading to tubal damage and reduced fertility. There was a very nice paper a few years ago from an African population. They found that women with tubal factor infertility had higher incidence of bacterial vaginosis and abnormal vaginal flora. So patients who are undergoing IVF, they assess the bacterial vaginosis with both Nugent score and PCR. They found that the implantation rate was reduced in women who are bacterial vaginosis positive compared to bacterial vaginosis negative patients. So it's very important to understand that because of the hormonal fluctuations or the changes which happen during an ART cycle, they may have a likely impact on the vaginal microbiome, and this can have an impact on the success of our IVF cycle. So this is, we are going, there was always an argument about whether we should do freeze-all in all patients and cryopreserve our embryos and go for a frozen embryo transfer in a subsequent cycle, whether it's more physiological state. So this is another argument, we can say that freezing and freeze-all and subsequent frozen ET in a more physiological state may be more beneficial, looking at the impact of vaginal microbiome on the ART hormonal changes on the vaginal microbiome. And then again, vaginal microbiome, it is shown that the Enterobacteriaceae and the Staphylococcus, if they are found at the tip of the uterine of the ET catheter, they were associated with a poorer outcome. So there were some studies which they looked at the tip of the catheter, the microbiota, and they found that whenever there was staph or streptococcus infection, there was less chances of conception. So this is a nice meta-analysis presented in 2013, looking at the risks which are associated with bacterial vaginosis in infertility patient. So meta-analysis and systematic review of 12 studies, which explores the role of bacterial vaginosis on infertility, and it found that bacterial vaginosis was more prevalent in infertile women than in the pregnant women of the same population. So 1 in 5 infertile women had bacterial vaginosis, and 1 in 3 had abnormal marginal flora. And this was more prevalent in women with tubal factor infertility as opposed to women with non-tubal factor infertility. There was more preclinical pregnancy loss, but there was increased risk of first trimester miscarriages in this group of patients. Then another paper from 2012 again, where they looked at the dynamics of vaginal microbiome during infertility therapy with IVF-ET. They looked at 31 patients who were enrolled for IVF, and none of them had active signs of infection. They took the swabs from the posterior fornix on the day of the baseline ultrasound, on the day of oocyte retrieval, on the day of embryo transfer, and 6 to 8 weeks post-pregnancy. So diverse vaginal flora at the time of ET appeared to be a very important factor on success of ET, and if the flora was Lactobacillus dominant, it would lead to more successful outcomes. So women who had Lactobacillus dominant vaginal microflora on the day of the ET, they are more likely to end up with a positive pregnancy test. And they found that the circulating E2 and P4 levels had an impact on the microbiome. So following the trigger of HCG, when there is a drop in the E2 levels, those group of patients had more chances of live birth. So decreasing the E2 to be necessary, but not sufficient enough to say that there is a successful outcome. So from the time lapse from the administration of HCG to embryo transfer, 76% of the patient, the reproductive tract microbiota changed while their serum E2 levels decreased, and this turned out to be more beneficial. And subsequent papers from 2000, where 40% of the patient who had IVF cycle had abnormal flora, and there was a study which was done in 2000 where they saw that 91 women who are undergoing IVF with embryo transfer, if they recovered Streptococcus viridans from the embryo tip catheter, the pregnancy rate was only 6% as opposed to 35% if it was Lactobacillus dominant. Then, so there are a number of studies which showed there was a 50% reduction in the pregnancy rate where bacteria were discovered on the tip of the ET catheter. So this comes to a question which we need to ask ourselves, that is the vaginal microbiome testing is it a predictor for IVF or ICSI success outcome or not? So we need to ask two questions. Is the presence or absence of certain bacteria associated with failure to become pregnant following an IVF ICSI cycle? And can the composition of this vaginal microbiome, can we use this as an independent factor to predict the success of the cycle? So whether should we go ahead with the embryo transfer, or should we freeze all and do an embryo transfer in the subsequent cycle? Can we use this vaginal microbiome and identify the patients who are going to end up with the positive results so that we can avoid the repeated physical as well as emotional problems which the patients go through with repeated failure of IVF? So what did this study do? This was a prospective cohort study which looked at 192 women with 20 who are in the reproductive age group who had planned to go for IVF ICSI, and then they had the vaginal microbiome checked before a fresh ET. Low percentage of Lactobacillus in the vaginal sample, they were less likely to have a successful embryo implantation. So microbiome profiling enables accurate prediction of both the failure as well as success of the fertility treatment. And women who had an unfavorable profile has a 7 times lower chances of achieving a pregnancy compared to a woman who had a favorable vaginal microbiome. So the knowledge of microbiota enables the couple to make a more balanced decision regarding timing as well as continuation of the IVF ICSI treatment cycle. So without a favorable microbiome, the implantation and subsequent embryo development seems to be compromised. One of the potential opportunities to improve results after IVF-ICSI with the use of microbiome profiling is to counsel the women to postpone the ART and await a favorable profile. We can offer therapeutic options which can make the unfavorable profile to a favorable one by using probably antibiotics or pre and probiotics. So maybe the future is this, where we can check the vaginal microbiome and predict the women who are more likely to be successful in order to avoid disappointments. So this is another paper from 2011 which looked at the possible beneficial effects of lactobacilli and fertility, which and they showed that the Lactobacillus crispaticus levels, they are the best, they are the good bacteria. The Lactobacillus crispaticus is highest acidity which is going to give compared to the other species, and that is the most preferred one. So if the vagina is dominated by non-lactobacillus bacterial species, it's shown to have poor reproductive outcome with a lower pregnancy rate, implantation rate, increased risk of pregnancy loss, and reduced live birth rate. So the non-lactobacillus bacterial species which are associated with poor reproductive outcome are the E. coli, the Staphylococcus, the Streptococcus, the Enterobacteriaceae, the Atobium, and the Gardner vaginalis species. Then I have a few other papers. One, this is from 2018, the receptivity cohort study to validate the urogenital microbiome as a predictor for IVF. So this was again a prospective study with 300 women who were planning to go ahead with IVF or ICSI. And prior to this IVF-ICSI, they had a midstream urine sample and a vaginal swab taken. The endpoint was to look at fresh embryo transfer and pregnancy following fresh pregnancy, embryo transfer within 1 year of enrollment. So the predictive knowledge of the microbiome profile may enable couples to make more substantial decision on whether to continue treatment or not. So hence unnecessary physical and emotional burden can be avoided. Again, this study also found that doing this, those who had lactobacillus dominant environment, they had better chances of pregnancy. This is a very recent paper from 2020 looking at the vaginal microbiome as a tool to predict IVF success. So vaginal composition prior to start of hormonal treatment for ART seems to be predictive in IVF-ICSI outcome, with mainly a highly negative predictive value. So the local microbiota, the presence or absence of certain specific microbiome within the parts of the female genital tract are associated with the outcome of ART. Then this is another paper which looked at the composition of the vaginal microbiome and the seminal microbiome in predicting the success of IUI cycle in patients with unexplained infertility. So what they did, they took the vaginal and the seminal microbiome of 23 couples with idiopathic infertility, and they analyzed the vaginal swabs and the seminal fluids which were collected on the day of IUI through PCR amplifications. And they found that the idiopathic infertile women showed a different average composition of vaginal microbiome compared to the controls, while for seminal counterparts, there was no difference. And the vaginal lactobacillus crispatus domination was a strong factor to success of IUI. So again, the lactobacillus crispaticus is promoting a favorable environment for pregnancy, and then suggests that the microbiome characterization could be useful along with other clinical and lab assessment in pre-IUI evaluation of infertile couple. So maybe in the future, when we may have more tests available regarding testing the vaginal microbiome and predicting the success of our IVF. Now, after the vaginal microbiome, we'll talk a little bit about the uterine microbiota. So although the uterine cavity is a continuation of the vagina, they are connected, but the microbiome which is found in the vagina is seen to be different from that in the endometrium microbiota. So essential to understand the upper genital tract microbiota, because it's got a physiological as well as the pathological processes which are taking place within the uterine cavity are different, and they are going to have an impact on the implantation of the embryo and continuation of our pregnancy. But the problem is difficulty in analysis because of the small amounts of material, starting material, and this can be easily contaminated by the exogenous bacterial DNA. So careful and appropriate investigation of the endometrial microbiota is essential to detect the uterine dysbiosis. So endometrial microbiome in ART, most recent study analyzed the impact of endometrial microbiome on the reproductive outcome. So analysis of endometrial fluid was done in 35 infertile patients who had recurrent implantation failure. The results of this study showed that the endometrial microbiota profile, which was lactobacillus dominant or non-lactobacillus. So when they did this study, they took the endometrial sample and looked at the endometrial microbiota profile, and what they reported it as either the endometrial environment is lactobacillus dominant or non-lactobacillus dominant, with a cutoff level of more than 90% for the lactobacillus dominance was considered as a significant factor to predict the reproductive success. So if the lactobacillus environment was more than 90%, such women had higher chances of pregnancy. If the lactobacillus domination was less than 90%, there were adverse reproductive outcome with lower implantation rate, lower ongoing pregnancy rate, and increased miscarriage rate in this group of patients. So around the periconceptional period, a cytokine network is there where the embryo has cytokine receptors, and various cytokines and the growth factors which are released from the uterine epithelial cells and the oviduct of the maternal oviduct, they influence on the proper development of the embryo and adaptation of the embryo to the micro environment. So this cytokine environment, which is present around the embryo, is created by the microbiota, and this is going to help the embryo to navigate towards the endometrium and allow for the implantation. So when the uterine microbiome is altered, or there is any kind of uterine infections, they are going to have an impact on the cytokine receptors and cytokine network and influence the success of implantation. So this is a paper from American Journal of Obs and Gynae, which gives an idea about evidence that the endometrial microbiota has an impact on implantation success or failure. So this again saw that non-lactobacillus dominant microbiota in a receptive endometrium was associated with significant decrease in the implantation. So it was only 60%. If there is a positive environment, it was 60%. If it is a non-lactobacillus dominant environment, it was only 23%. Similarly, for the pregnancy rate was only 70% as opposed to, it was only 33% as opposed to 70%. With an ongoing pregnancy rate of 60% with a good lactobacillus environment and 58% live birth rate as opposed to only 6.7% when a non-lactobacillus. So there is a marked difference in the continuation of pregnancy and live birth rate, and such is an impact of endometrial microbiota on the pregnancy as well. So existence of endometrial microbiota that is highly stable for the endometrial receptivity is essential for good reproductive outcome. So how can we check the endometrial microbiota? Nowadays we've got this commercially available tests which are based on a next generation sequencing approach, where we can collect the endometrial sample, and once the sample is classified as non-lactobacillus environment, we can treat with antibiotics, prebiotics, and probiotics. But the disadvantages, these tests are only based on observational studies using limited number of patients. So there is very limited evidence for testing and subsequent clinical decision making. So we need more research in this field to establish the core uterine microbiome before we can recommend any treatment for dysbiosis to this group of patients. So this is from a very recent paper on RBM Online, because the evidence is very less because we've got limited patients and fewer studies. So if we have more research, more information, we can universally apply to all our IVF patients to offer them the best possible chances. So the future is, if you give antibiotics, as you know, we might disturb the flora more. So it's always good to combine with probiotics, which are containing the more of a lactobacillus dominant thing. So the advantage is, because these probiotics are more natural products, you can use it for a longer period of time. You can combine it with antifungals and antibiotics, and particularly patients who have, it's not only for probiotics. I'm not going to promote only for the cases for fertility, but even probiotics are useful in patients who have recurrent vaginal infections. So those patients of higher recurrent vaginal infections, always with your antifungals or antibiotics, we can combine it with probiotics to improve the natural environment within the vagina and reduce the risk of repeated infection. So among these various vaginal specific probiotics, Lactobacillus species is the most researched strain of probiotic for establishing and maintaining a healthy environment. And other strains such as Lactobacillus rhamnosus and Lactobacillus reuteri are also available. So most of the combinations will have rhamnosus and reuteri. So all of this helps to maintain the vaginal balance. Is one, they stick to the vaginal surfaces and prevent the harmful bacteria from growing. And they directly attack this harmful bacteria and kill them and prevent them from spreading. And also their Lactobacillus rhamnosus particularly, it can reduce the pH, produce short chain fatty acids, and provide protective effects against the pathogen colonization and lactate production. So this was from a very recent paper from 2019. So it's going to physically attack the bacteria, line the epithelial cells and mechanical barrier protection, plus it's going to reduce the pH and make the vaginal pH more normalized. So all of these probiotics are going to be positive. The probiotics are going to give immunological protection also through regulating, stimulating, and modulation of the immune response. They have an immunomodulatory effect also. So now when coming to the whether we should be giving them orally or vaginally, it's not very clear which route is more efficient, but oral is preferred over the vaginal route because oral formulations, it's very easy to administer. And when you take orally, as we saw that Lactobacilli, they can resist the pH of the gastric juices, it can resist the bile salt effect and pass through the intestine, and then through the rectum and the vulval skin, it enters into the vagina. So they, even if you give them orally, they will reach the vagina. So they can colonize the vagina and reduce the risk of bacterial vaginosis. So this is another paper from 2017, which talks about the pro and prebiotic treatment in patients with gut dysbiosis. So women with gut dysbiosis, not only the vaginal dysbiosis, sometimes even the gut dysbiosis also can have an impact, and giving this pro and prebiotics, these women can improve the pregnancy rate. So they looked at 53 patients who had acute or severe intestinal dysbiosis undergoing IVF cycle were recruited, and these were divided into two groups. Group A have they have to transfer two frozen embryos were transferred in both the groups of patients. Group B was treated with probiotics and prebiotic for 2 months before to control this dysbiotic situation, and Group A had direct embryo transfer. Following FET in the Group A patients, there were only 5 ongoing pregnancy and 3 live birth rate. Whereas in Group B, there were 15 pregnancies with 12 live birth. So there was a significant increase in the pregnancy rate in patients with severe or acute intestinal dysbiosis when they were treated with probiotics or prebiotics. So there is a significant impact of this on the embryo implantation. So now we have insufficient evidence to say that the reproductive tract microbiome on the day of the embryo transfer has an impact on the pregnancy outcome, when more common species like Lactobacillus crispaticus are the one which are more useful. Now there's a new area where microbial transplants, where you can not only the oral pro and prebiotics, we can have vaginal microbiota transplants, which is opening up new frontiers for reproductive health. This involves a transfer of cervicovaginal fluid from healthy donor to the patients in whom we want to restore the beneficial microenvironment. So VMT from healthy donors can be used as a therapeutic alternative even for patients who have symptomatic, intractable, and recurrent vaginosis. So, uterine dysbiosis, you can give antibiotics, we can give probiotics, we can give prebiotics, and now we've got the microbial transplants, which we are talking about. They're not available, I think, commercially at the moment, but this is something which is in the research. So we can create a healthy and micro environment and enhance our pregnancy rate. So with this, we come to the end of the talk. So with some take-home messages, I will just summarize my entire talk. So now with the available molecular-based technologies, it has now revolutionized our knowledge about the vaginal microbiome. So now our understanding about the vaginal microbiome is much more than what it used to be before. And we are now able to identify these microorganisms that were not detected previously. So we are adding to these missing pieces to the puzzle called the reproductive tract microbiome. Only certain specific Lactobacillus species are the ones which are considered to be a part of this healthy flora, and they play a very important role in maintaining a supportive environment for the implantation of the embryo and also the future pregnancy outcome, be it the miscarriage rate, premature delivery, or the live birth rate. And the vaginal and the uterine microbiome are different, and vaginal dysbiosis will increase the risk of STDs and PIDs, which will increase our risk of tubal factor infertility. There is a window of opportunity for improving our IVF reproductive outcomes by identifying the women who have abnormal vaginal microbiome, including bacterial vaginosis, which you can treat it well in advance to maximize the success of our IVF. And there is an emerging evidence that there is a role of uterine microbiome and also chronic endometritis in patients with infertility, particularly patients with recurrent miscarriages and recurrent implantation failure. So doing microbiome profiling for this group of patients with the next generation sequencing, these are the tests which are commercially available, but to what extent and how human uterine microbiome are involved in implantation, we need more studies. And then the recent studies have shown that embryos which are transferred in a Lactobacillus dominant endometrial environment are going to give us a better pregnancy rate. So whenever you find patients who are having vaginal dysbiosis or a uterine environment which is non-Lactobacillus dominant, along with the antibiotics, we can give pre and probiotics to maximize the effect of our therapy. Newer therapies such as pro and prebiotic and microbiota transplant, they're gaining popularity for improving and maintaining the optimal composition of the microbiota. But in order, we need more trials to formulate best administration regimens. So this pre and probiotics can be given for bacterial vaginosis, for recurrent infections, for fertility. And as I told earlier, there is so many things so many areas in which this is gaining importance, the microbiome. So with this, we come to the end of the talk, and if anybody has any questions, we can take, Prachi.
Yes, ma'am. Thank you very much. Actually, ma'am, your presentation was kind of an eye-opener to us. There's so much of new data you have presented, and it has a really great slides and great data, ma'am. Thank you very much.
Thank you so much.
Well, first of all, you have yes, ma'am. First question, ma'am, you have mentioned about transplantation of microbiota. Ma'am, can you little elaborate on this?
Can you be a little bit louder?
Any new info?
Sorry, Prachi?
Transplantation, ma'am. You mentioned about transplant.
Vaginal microbiome. Yeah, that are into research. What they did was they took the they identified women which had healthy micro environment, and they used to make the vaginal microbiome transplants, which they put it in the vagina of the women who had recurrent vaginal infections. And they found that this was useful in this group of patients. So, but that is still not available, I think, commercially. It's more into research, and that was a very recent paper from 2020.
Right, ma'am. Ma'am, do you recommend all the women who are undergoing ART to get probiotic treatment, considering lactobacilli is the helpful bacilli or microbiomes?
Yeah,
in
yeah,
your
I think
practice?
so. It is always a good idea, because we are practicing, we are giving them just a 1 month while they are while the patient is there, they are waiting for any fertility treatments and all. For a month, we can put them on the probiotics. It's going to be definitely useful. Particularly, a lot of our patients are PCO patients, and as you know, gut dysbiosis is so much linked with the PCO. So, giving these probiotics to patients who are PCO or any fertility, any infertility patients, it's going to be having a positive impact, and it may give us a better result. So I am actually quite positive and quite supportive of giving probiotics. And
Thank
even
you, ma'am.
patients with recurrent
There is a
vaginal
question.
infections as well.
Yeah. Yes, ma'am. So there is a question from Dr. Rama Prasad. The question is, how long the probiotics treatment is advocated in
Oh, just
ART?
1 month. We give it pre IVF for a month.
Okay. And would you prefer single strain probiotic or multi-strain?
Yeah,
I guess
most
multi-strain,
often
I mean,
in the market, the probiotics which are available, they are multi-strain. Most of them have Lactobacillus rhamnosus, Lactobacillus reuteri. These are the strains which are predominant in the available commercial preparation. So always when you look at a probiotic, we don't have a single strain one much available.
right, ma'am. Right, ma'am. And ma'am, any endometrial receptivity and any sample checking at the endometrial level, the infection or microbiota, is that recommended or routinely done?
See,
Microbiome at the
only one
endometrial
company is
level.
offering this test, that is called as EMA and ALICE. EMA is the Endometrial Microbiota Metagenomic Analysis, and looking for infection. Only one company is offering this EMA and ALICE test. So what they do is they take an endometrial sample, and then they will give you information regarding which are the microbiota which are dominant in the endometrium. So they'll tell you whether it's lactobacillus dominant or non-lactobacillus dominant. And also they're going to give you the information regarding the specific infections which are there in the uterine environment, and what is the right antibiotic which we can use to treat this infection. But these tests are expensive. One, they are expensive. Two, we've got only limited evidence. Limited studies have been done for these tests, and these tests are available in the last couple of years only. So the cost of the test plus limited evidence. So that's the reason why most often we don't end up using these tests. And these tests are not recommended for every patient pre-IVF. This is more reserved for patients with recurrent implantation failure or patients with recurrent miscarriages. Then we can convince the patient to, do these tests. So because of the cost factor and limited evidence of the usefulness of this test, they are not used widespread. But of course, we have something which we can offer to patients with recurrent implantation failure and recurrent miscarriages.
Right, ma'am. And of course, in a routine recurrent vaginal infections.
Yeah,
Also,
that is routine. You combine
this
it with your fluconazole and it's going to
treatment
reduce.
with the pre, or antibiotic would.
Yeah, yeah. Just a month of therapy is going to give her a reduced recurrent rate of infection.
Okay, and subsequently, if she goes for ART, definitely that is going to help.
Yeah. So it might be a good idea, to give probiotics always. It's something which I prefer actually.
Right, ma'am. Thank you, ma'am. Ma'am, there are no more questions, but of course the talk was excellent and there is a lot of learnings for us and a lot of new insights. So with this, Thank you very much.
Thank you so much, Prachi. Thank you. Thanks everyone for whoever have logged in and attended the session, and thank you Shield and the entire team of Shield, Prachi and everyone for giving me an opportunity to connect to so many people.
Yes, ma'am. There are a lot of comments and a lot of positive comments and beautiful comments are there. I will share separately those comments. Everybody has liked your talk, ma'am. Thank you very much.
Thank you so much, Prachi. Thank you.
Thank you.